NAC bothers my MCAS. So NAC can also stabilize and help with histamine, which is what this person's talking about, is mast cell activation, which is where part of your immune cells release inflammatory compounds like histamine, tryptase, those sort of things. If NAC bothers it, we need to more so probably look at a couple of factors. Is it doing too much detox for you, and that's what's actually aggravating the mast cells? Do you have a sulfur sensitivity that aggravates the mast cells, right? And so we can back up, which we'll talk about now. It's a good segue. For some folks, when we're building a protocol, we can't start with detox. This is why it's good not just to, oh, is this good for mold? We want to know, is this good for you when you're dealing with mold? That's the key here, and that's what this is all about. So some folks, like Heather here on Facebook, we've got to deal with mold as an allergen first, right? Because it's aggravating those mast cells. Now, mold as an allergen is what most of us think about when we think about mold. If somebody goes, oh, you just got a little mold, we'll just take an antihistamine. That's what the thing about. And sadly enough, that's what most people in the medical community are thinking about, is mold as an allergen. Now, it's still a factor, of course, right? But it's not the major issue like we just talked about the toxins, because mold, the mycotoxins, they directly increase histamine production in our bodies, create an immune response, aggravate our mast cells. And somebody with mast cell activation syndrome is probably feeling pretty miserable. They're reacting to a lot of things, right? So that can make us with skin flushing, red skin, hives, rashes. This is how mold causes asthma. Guys, let me read this quote from a study to you. And this is a direct quote. Mold is one of the largest risk factors for asthma, increasing asthma risk by 53%. Everyone with asthma should consider mold as a possible cause. Anybody with asthma needs to rule it out, because what they're actually seeing in a lot of the research is that mold is the primary cause in asthma in a lot of individuals. Okay, so asthma, eczema, headaches, irritability, loose stools, dizziness, anxiety, difficulty sleeping, itching, burning, acid reflux, stomach pain, low blood pressure. When mold is an allergen, it can cause all those aspects. So sometimes before we can detox it, we have to stabilize the inflammatory allergy part of mold on there, or we have to do it at the same time, right? So how can we help the body lower histamine? And this is with NAC, right? We can talk about this too, is stabilizing this first. Okay, so we can look at a couple of factors. One, we might need to, and some folks might need to start with these individually, or we might need to open up as singles. So Microbalance makes a combination product called Histamine Relief, full of a lot of things that are mast cell stabilizing and natural antihistamines. Here's an important caveat, because when I say antihistamines, most of you think of what? Like diphenhydramine, or brand name Benadryl, or loratadine, or Claritin, right? Over-the-counter antihistamines. Those are not actually antihistamines. What they do is they block histamine receptors, whereas natural antihistamines work on multiple ways. They stabilize mast cells so you don't release as much histamine. They help your body use the enzymes to break down histamine, and they help block histamine receptors. So it's different, right? So quercetin is a natural bioflavonoid that helps to stabilize mast cells as an antihistamine. So you can get a combination product like Microbalance's Histamine Relief, or by itself. Stinging nettle is in there, vitamin C, NAC, bromelain. They're all in there to do that triple factor of break it down, block it, neutralize it, right?